So here is our pelvis. If you're looking in from the top down, this is our pelvic floor. The series of muscles here goes from the front, from our pubic bone, all the way to the back. All right. So if we're looking from the outside in, from the bottom up, you'll see we have our anus or rectum, we have our vaginal canal or introitus, and then we have our urethra, our opening of our urethra. So that's where our urine comes out. And so I'm going to take this off so you can kind of appreciate what I'm doing here. So I'm going to use this space as the vaginal canal, okay? So I can get access to the pelvic floor muscles. So when we're doing a little internal work on ourselves, we can use our own finger, okay? Or if you have a partner who is willing, then they can use their finger. Make sure you wash your hands, keep your fingernails trimmed, all that good stuff, okay? And you can also use some lubrication if you prefer, okay? And it's recommended. So going back to that finger, we're gonna go into that first knuckle here, okay? So we're only gonna insert to the first knuckle. And if we're gonna look at pelvic floor or the vaginal opening like a clock, the 6 o'clock position, it goes towards the anus, okay? Then there's 3 o'clock and 6 o'clock. So we're only gonna stay in this range here, okay? We don't wanna go turning all upwards and messing with our urethra, okay? So we're just gonna enter and just kind of press down a little bit. And as we're pressing down, we should feel like a little soft, gentle muscle tension, but it shouldn't be too hard. And it shouldn't be like way so soft where you're just like going for days. So usually at this point, if you're pregnant or about to give birth, you might not have, a whole lot of laxity, but you may be more tight and tender and painful. So if you do have a tender spot, you just want to press and hold. So if I flip this around here, you're inserting and then just kind of pressing and holding, okay? You can go around and just kind of press and hold and making sure you're relaxing. You can utilize the breath and the breathing techniques that we went through before. So once you've gone from your 3 to 9 o'clock position, then you can insert a little further to that second knuckle and do the same thing, okay? Just kind of pressing, holding, seeing what the muscle feels like, getting a little bit deeper into that pelvic floor. Then when that's good, you can insert your finger all the way and you can see how you can reach a little bit further back, okay? And just kind of pressing and holding. You might feel this more on your backside here. It might feel like it's just a deep backside sensation, and that's okay. But in order to reach that back there, you might want to have a partner for that portion, okay? All right, and so that is how you can do some internal work on your pelvic floor.